Do you ever wonder why your bone graft didn't take? Do you ever wonder why your bone regeneration site lost the volume quickly? These are some of the key aspects in bone regeneration that you should always keep in mind prior to bone augmentation. Number one, you should store your bone in a cool area with sterile saline solution, not sterile water. Sterile water may actually lead to cellular apoptosis, that is cellular death, as a result of the difference in osmotic pressure. So you always want to use sterile saline or PBS, phosphate buffer saline solution, to keep your bone grafting prior to the augmentation. After you harvest your bone, note that you may have up to 4 hours of working time, provided that you will store that bone in sterile saline solution. You could possibly have longer period of times if the sterile saline solution is cool. Cooler temperatures can prolong the osteoblastic activity and the viability of cells of bone particles that are kept in cool sterile saline solutions. Research has shown that we could prolong the viability of those bone particles for up to 24 hours if stored in a cool place of about 4 degrees Celsius. So again, remember that the osteoblastic activity or the ability of those bone particles to shed osteoblast into the surrounding area increases provided that you will store those particles in saline solution, sterile saline solution, not sterile water. You know that the bone harvesting technique may have an impact on cellular viability, as well as the release of growth factors and BMPs, bone morphogenetic proteins. Also, the size of the particle, the size of the bone particle may have an impact on the release of growth factors and BMPs. Bone graft particles of about 1 to 2 millimeters seem to perform better than sizes smaller than that. The bone slur or the bone grafting material that you can get from your drilling when you place an implant, that kind of powder may not have the same osteogenic potential as particle sizes of bone of about 1 to 2 millimeters. The bone particle size may have an impact again on the release of growth factors and positive osteoblastic growth, that is the ability of those particles to shed bone producing cells, osteoblast, into the surrounding areas. Particle sizes of about 1 to 2 millimeters have good osteogenic potential, as well as particle sizes of 2 to 5 millimeters. Summarizing, we are to expect positive osteoblastic growth, that is, positive release of bone producing cells from those particles in particle sizes 1 to 2 millimeters or 2 to 5. Also, the technique may have an impact on the release of those growth factors. So you want to store those particles while you're working on your surgical site in cool, sterile saline solution, PBS or phosphate buffer saline solution, not sterile water. These pictures are under the scanning electron microscope. You see bone producing cells, osteoblasts, that start multiplying, and in about 4 to 6 weeks they create a confluent layer or mesh, like a spider web that will fill in the space. This is again what your own bone can do. Again, a tiny little particle of about 1 to 2 millimeters can start shedding osteoblast into the surrounding tissues in a short period of time and will produce an infrastructure like a spider web of cells that will interconnect with each other, creating that mesh that will be forming the new bone, the new tissue. Eventually that layer, that confluent layer of osteoblast or spider web, will mineralize, becoming actually true hard bone. So why use something else when you can have your own? All these are considerations that we need to make in our treatment planning prior to bone augmentation procedures. And when we follow the biologically sound principles of periosteal guided bone regeneration, we are likely to boost bone regeneration because of the compounding effect of periosteal guided bone regeneration and the osteogenic potential of autogenous bone.